A boat.
Yeah, where from? From
Germany.
England? Germany.
Yeah.
Oh, that's really good.
Yeah.
Hydra Guide. So, good afternoon and welcome to 65 Beauty on what is the third sunniest day in winter.
Yeah.
Isn't it beautiful?
But it's still cold.
It's still cold. But I like these sort of days. I can't stand it when it's gloomy and dismal and cold. A bit of sun like this, I really like.
Yeah, it was on Christmas time.
Yeah, it was the same. Yeah.
Yeah.
It's been amazing. I think, although I don't want to be a conspiracy theorist and say about things like climate change, but definitely things are changing. Let's be honest. You don't have to look very far to see that our weather has definitely changed. Because this, for me, reminds me of being somewhere like Switzerland or maybe your country. What's your country like in the winter? Is it bright?
No, it's a lot of snow now.
Yeah, but is it bright still?
Yeah. Yeah, it's
like this.
Right. Yeah, it's nice blue sky.
Yeah, dry. And cold and snow.
Minus 25 sometimes.
Really?
Yeah.
Minus 25. I wouldn't go out. You wouldn't catch me going. I wouldn't go. I'd have to wear a hat to bed.
Naked.
In fact, that reminds me of a girl that I dated when I was younger. She was from Africa, and she felt the cold all the time, so she used to go to bed with a north-faced woolly hat on and a pair of gloves. It was not very sexy at all. Hi Rosa, happy new year. So we're here to talk about a bit about what we're doing in January. There's a couple of things that we're going to talk about. Agnes, if you've not met her, you've been here now, what, 2 months?
Yeah, already.
When did you start the beauty field?
15 years ago.
How old were you then?
From 20s, I think. Yeah, now I'm nearly 40.
So mid-20s. Oh my God.
So nearly 20 years.
Near 40. Thank God for Botox and a bottle, eh? 20 years you've been in beauty, doing everything from facials to stuff. When did you become a teacher? So you can teach it?
After maybe 5 years, when I'm finished everything, then, I get more confident, and then
so you've been teaching for 15 years.
Yeah.
Wow. So she has joined us about 8 weeks ago, and I've got to say she is a fantastic addition to the family. And it's not just about work, we actually like you. So
yeah, I remember after 1 week you said, oh my gosh, you look like you, how many years?
It's lovely. And I think that's really important, because let's be honest, you spend more time with people you work than who you date.
Yeah.
So it's important that we get on, and you've really been a good addition.
But that's not a good boss as well.
That's not what we're here to discuss.
Yeah.
We're here to discuss a couple of things. So what Agnes is doing for us is she is doing everything to do with beauty, whether that is training. So if you're a nurse or you're a non-medic and you want to learn how to train into beauty, what can you take them to? Level 3?
Yeah, and level 4 semi-permanent makeup.
Oh, perfect. So level 3 in beauty and level 4 in semi-permanent breakup, which will be a perfect foundation. You can add Botox and skin boosters onto that as well. So that's another reason why we decided to work together, because she brings a whole raft of other training. But of course, it also means that you can look after our patients in beauty, which we've never had before. It's a bit weird, isn't it? Because the name is 65 Beauty, but you're the first beautician that we've ever had. Work that one out. But what's in her name, eh? What's in her name?
Yeah.
If I could get your name right, then we'd be fine.
Yeah.
So, you're Chocolate. Hi, I'm Chocolate. I'm a Chocolate. Okay, nice to meet you, Chocolate. So what Agnes is here now, she's here every day in both clinics. So she's available in London and also Brentwood, and she's doing all the facials. So we've got some things to talk about, including this new toy that you've got, which I like the look of this toy. So talk us through this. Happy New Year, Emma at 57. So what is this?
This one, I'm always, when clients come to me for facials, I try have a look in the skin and how need hydration needs, so like before. So
this shows you how hydrated you are or not?
No. How you need very deep or it shows like your skin is dry or is oily,
Oh,
or
okay.
yeah.
Well,
So
let's do it on me then. See what happens.
yeah, so we can check on
Um,
yours actually. Yeah.
Someone's saying how, I think. Guess to how? Oh, we'll come on to that in a
Okay, so
second.
this side, I'm gonna check this side. Yeah. So 34 free.
What does that mean?
Yeah, that side is not bad.
So it says I'm 30% hydrated.
No, it's never come like 100. No, no. It's I'm gonna show you different. Wait. So next one is here.
Because you could be different on different parts of the face,
Yeah,
couldn't you?
yeah. Look, this one is 20.
Oh my God, look at that. Yeah, 20.8.
Yeah,
so this side's drier than this side.
Yeah, so maybe you sleep on that side, maybe.
Maybe,
that,
I probably do, yeah.
Yeah.
What about my forehead?
Yeah, I'm gonna check.
So this is something you use before you do any facial work as part of the consultation, is it?
Yeah.
Yeah.
29 and 8 is not too bad.
So not
So
too bad.
that side is more dry.
Than this side.
Yeah.
Hmm.
So we can check your nose actually, because
Yeah.
I can see dry skin on your nose. Don't wanna.
I'm dead, am I? All of a sudden, I'm so dry. I'm
25 and
25. So yeah,
25.
so low.
24 and 5.
So low.
Mm-hmm.
I like this. So it takes
Yeah.
the guesswork out of it. So what would you then do if that was so with me? What would you do now as a facial?
Yeah, hydrofacial.
What does that
We
mean?
have new one.
Yeah.
How's it called? Hydrofacial.
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 Where you suck it. You suck the.
What do you mean?
Where you suck the dirt out of the skin.
Yeah. We put a lot of products. We like hyaluronic. You know, all treatment is like moisturize, and with the steamer we open pores, so it's more creams is going inside. And
Emma's asked, what's the ideal reading?
what's
the best if you were looking for someone's skin?
Yeah.
What's the best it could be? You said it can't ever be 100%.
Yeah, it's 40% is very good result.
Is it?
Yeah.
Anything up to 40.
Yeah.
So at 20 on this side is
It's
not
very
great.
bad.
This side. And would it change different times of the day?
Yeah, can be. Like if you, I don't know, go to outside, it makes your skin more oily. But you know, now where it's dry room, so it shows like proper.
Excellent. And then you've got some things that you're going to show us. So obviously a steamer here, which I guess everyone's seen, but this is a big old boy, isn't it? This is not for making tea. So what does steam do when people? So at home, I suppose they could stick it over a pot of boiling water with the towel. That's quite popular.
Yeah, so
what does steam do?
It's open pores, and actually it's react your all skin. So all boosters, all creams, serums is going deeper. So when you make a warm skin, you know, when it's your pores is closed, then you know it's don't wanna take all products. When
Right.
it's open, that's why we cleaning face with the warm water, not with the cold. When you wanna close the pores, you need to clean your face with the cold water. So that's why we open pores, so it's more absorbed.
So when someone's in the shower, if
yeah,
they have a hot shower,
not hot, but
are
yeah.
their pores open at that stage?
Yes.
So what should they be doing in the shower?
Clean the face,
Yeah.
you know, like a couple times with the cleanser, and then make it dry.
Yeah.
And then put creams, serums, everything special on
At
the
that
night
stage,
time.
because
Yes,
the pores are open.
Yes.
And how long do the pores stay open?
Depends if you go outside or you change your room. Maybe it's gonna be colder, and it's
But you've got time.
closing.
You've got
You
time
have
to
time.
do the
like
things.
10-15 minutes is alright.
And it's
You
really-
can put like more creams, everything.
It's really
especially on night time.
It's really funny you should say that, because when you first came in here, we looked at the difference between doing a skin booster with the pores open and the pores closed. And I think you were doing someone's lips with semi-permanent makeup, and I think you were talking about how the numbing cream goes in further because
yeah. When
made
you
a hole.
put the cling film, you
Yeah,
remember?
but when you make a hole, so you put the numbing cream on to start with, but then you put more on halfway through. Because you made the holes.
Yeah.
Which is something that we'd not thought about in medical, because we don't really think about things like that. It's all no, but actually it makes so much sense.
Yeah, but when you put numb cream as well, you can put cling film, and it's gonna work quicker because it's warm. You know, same like on your feet today, you put warm water. Yeah, because warm is that's why red lamp is make warm.
Yeah,
that is going deep.
It's going good.
Yeah.
Excellent stuff. So 2 things I've learned today. So what we've decided to do with Agnes here, obviously Agnes you can come and have your facials, and you can come and do whatever Agnes does.
Yeah, and they have very good products.
Yes, we use Eve Taylor. So I don't know if do you know the story about this woman?
No.
Right. So the reason why we've got Eve Taylor here is because I met this woman in London. So Eve Taylor is about 94 years old.
Wow.
And she's still making this by hand.
Wow,
obviously, it's a lot bigger now.
Yeah.
It's all done in a big factory somewhere in London. But Eve Taylor, and the products are really good.
I read like ingredients. It's amazing ingredients. And you know, when you're working with the facials, sometimes skin is very reacting products.
Yeah.
So now I work in 2 months and it's nothing. I'm always ask clients, you know, are you feeling something, or maybe it's start itching or something.
So I've got an account with these. So if you want to buy products for them to take home, they can have these products in smaller to take home. So we can talk about that. So what we're going to do, we're going to work together, and that's one of the reasons why we came on today, is because in January people's skin is dull.
Oh yes,
why,
after drinks.
I was going to say, why is that? So we'll obviously Christmas, you're eating bad food.
Yes, stress. Yeah.
What else? Wine, beer.
Wine and weather. You know, it's very cold outside, and kids at home.
Yes.
Oh my.
Is that why women have those fuck off lines?
Yeah, fuck off.
So we decided to celebrate summer in winter.
Yeah.
So we've got a package together where we're using one of the top skin boosters. So for those on this channel, you may have used this before. So this has got H and HL in it. You've heard me say that before. So that's got 32 milligrams of hyaluronic acid, which is exactly the same as Profilo. So that's going to plump the skin. It's going to make the skin feel really hydrated. But the other thing it contains is vitamin C, glutathione, and tranexamic acid. So for those who, can you pass me that book? For those who have been around long enough, you know what that means. This is a book I wrote, which you can download on Amazon, by the way.
We find the Bina in here.
Yeah.
Right.
So
which one is Bina?
Yeah, there she is. So you can download this book on Amazon if you want to download it. But what this talks about is how glutathione, vitamin C, and hyaluronic acid works together. So normally you'd pay £245 for this skin booster, but the deal we're doing for January, February, and possibly March is £225. But they get a facial with you first.
Yeah, including facial.
So
which one is cost like £90?
Which normally costs £100. Yeah.
It's for free.
It is for free. You don't like, I know this one don't like doing stuff for free, so get in quick before she changes her mind. And Bina. So the idea is that, and you've had a couple of patients today with this, where you've opened their pores and then you mesotherapy it.
Yeah.
Do you want to explain what that is?
With a small needle injected in the face, so it starts from 90 to 100% is working in skin layers, so it's much better than, I don't know, like a cream serum. You know, cream serum is working like 40%.
Oh, really?
Yeah, because we put on epidermis on the top and we clean, and it's not going deep. So this is maybe for, you know, just like how to say, just for home, you know, but if you wanna good result, you need something with the needle.
With the needle.
Yeah, this is.
And obviously, because what we spoke about a few seconds ago is that you're going to open the pores with the steam,
Yeah.
you're going to cleanse them, you're going to clean
like
the skin.
all treatment is about 1 hour, because mesotherapy is how long? Just 1 hour,
Yeah.
10 minutes, very quick. But all procedure is about 1 hour. So we open pores, we clean, we moisturize, we put everything to the skin, and it's ready for booster.
Fantastic. And the result is that summer glow.
Fantastic.
In
Actually,
January.
straight away after treatment, you saw that client. She's sitting in another one room like for 5 minutes, and I just came and I said, "Oh my goodness, your face is so beautiful.
It does look
already.
amazing. Yeah.
You don't need to wait tomorrow."
No, and that's the benefit of this product.
Yeah.
In fact, I got one of the nurses to do this on me the same day as a black tie event. So everyone was like, "You're mad." But I didn't use mesotherapy. We used that needleless gun that we've got, the one that shoots out ice. But it was fantastic. So we opened the pores. We then used the needle gun to get it into the face, and I was glowing at that day.
But that treatment in Lithuania was like 15 years ago. I finished 15 years ago, and now just coming here, all boosters. But it was really popular in Lithuania, 15 years ago.
I forgot to say, you're from Lithuania.
It's still very. It's like after injections, mesotherapy, revitalization is like a second, which one you can see very good results.
Hi, how are you, sweet Caroline? So yeah, that's what we're offering. So it's £225, which is less than what you pay for the skin booster. Oh, TikTok's done their normal thing and cut us off. That's all very good.
Why?
Oh, they didn't like something we were talking about. If you could share this live for me and like it, and we'll try and get some more people on. But so the skin booster is 225 with the free facial.
Yeah.
It's normally 245, and the results are pretty instant.
Amazing results.
Yeah.
Not just from that, from facial stuff. Like now, when everybody coming very tired, you have like a couple of minutes, relax and enjoy procedure. My old clients, they sleeping, and I'm doing massage, and I just like, oh.
No one sleeps in our chairs because
No.
we're putting needles in them. But yeah, it sounds like you've got a much better thing. How long does it last, Rosa? Yeah, it's a good point. So you're going to need 3 of these over a period of about 8 months, and then it's a good 2 years. I mean, your facials, you recommend it
every month, actually. Facial, it's not just open pores and clean the pores. It's like everything. You can see what needs the skin. I'm always asked for clients to bring all products what they use at home, so we can check. Maybe something is wrong. That's why your skin is dry. That's why it's reacting.
Yeah.
So it's everything. You can get all package, not just that.
It's funny you should say that, because I had a couple of patients in 2025 who would go to places like TK Maxx to get their skincare. So they would come and say, "Look, this is normally a £200 skin moisturiser, but the point is, if it's wrong for you, you're better off getting a £25 one from Boots that's right for you."
Yeah. Need to understand about ingredients.
Yeah.
Same like you inject, all ingredients, everything. So you can't go to shop and just think, oh, today my skin is oily. Maybe I need to try this one. Everybody think, they sometimes don't understand clients when it's dry skin and oily skin. Oily skin can be dry as well, because you drink water, because you're going to sunbath.
Or you do a job outside where it's constantly cold.
So
my motorbike, I suppose, because I get cold wind on I should shut my helmet really in the cold, should I? Otherwise it's going to chap my face.
Yeah, and it's red.
Well, thank you for pointing that out.
Yeah, yeah, you need to put some.
I need a new facial. The facial you did for me last time was actually really nice.
Yeah, and I see now his dry flakes is coming
So
again.
it's coming again. So
Yeah.
yeah, so that's what we're doing.
Yeah.
So 225 is on our website. It's alongside
It's
the
very
other
good price.
other
Come on, guys.
yeah,
It's
the
really good
the
price.
other winter offers. Olivia, the other winter offers is buy one get one free on blood tests, isn't it? What was the other one? Oh, 1495. Sorry, 1495 for a full facelift, which is pretty cool.
Yeah.
Second thing I want to talk about today, because this definitely affects Agnes, is tomorrow. Is it tomorrow it's going out, Liv? The cashback.
Yeah.
Yeah. So tomorrow we launch our brand new club, and we've called it the Cashback Club. Because that's effectively what we're doing. So the idea is that you sign into a 12-month contract with us where you pay £99 a month, but what we give you back is £180 worth of treatment a month.
Wow.
What you can do is you can save these up, or you could pay up front some months. So for example, a patient today came and paid for 5 months up front. So she gave us £500 today, but she's now got £900 to spend.
Yeah.
Which is
Very
brilliant.
Good. Yeah.
Which is brilliant. So that's why we call it cashback, because it's as simple as that. Everything is included, apart from Botox, because that's the Botox Club or the Anti-Wrinkle Club. But for things like you could see a private doctor, you could come and see Agnes as well once a month. You could have semi-permanent.
Yeah.
You could have tint.
Eyebrows.
Tint.
Oh, tint. Yeah, as well. Eyebrows.
You could go and see a private GP, have a drip, really do anything you want. Massage.
Very good
massage. And Sam. So if you pull your back and you need to see an osteopath, then you can use your credit for that.
Yeah. My daughter, she been with Sam.
Yeah, because your daughter's a dancer, isn't she?
Yeah. And
how's she getting on?
Amazing.
Yeah?
Friday we're going to next competition. Yeah.
And she wins, doesn't she? All of them.
Everything all the time.
She's never lost anything.
Sometimes, but depends, judges.
Wow.
Maybe don't
sometimes
like dress
racist.
or something.
Or sometimes they're a bit racist, aren't they? Let's be honest. It goes on. Yeah. So that's the Cashback Club, and I think it's going to be fantastic. We've made it even better. So it launches tomorrow, and one of the reasons why I wanted to come on live and talk about it is because for the first 20 people that join, there's no joining fee. So how cool is that?
Yeah. Yeah.
So you could turn up tomorrow, pay £99 and get £180 worth of product done on that same day, and then you pay next month and you keep going. So yes, I'm good, sweet Caroline, all good. Still got the same medical issues, but yeah, we're doing all right. It was really quiet last week, wasn't it? This week.
But it's normal everywhere.
Yeah, it's been quite
but it's coming busy. Look, today.
Oh God, yeah. Today's been really busy. I found out that some of the schools only went back yesterday. Went with some of the private schools.
Yeah. My son Thursday today.
Yeah.
Yeah.
How old's your son?
7.
You don't look old enough.
And my daughter.
I know, you look about 10 yourself, so honestly, your skin is amazing.
My secret is mesotherapy.
I know.
I do every month inject in my face mesotherapy.
Yeah, you've heard it from the beautician.
So today, that's why I said about this product. I really want to try it myself.
Yes, we can do it. We can do it right now if you want, live on the camera. Yes, you should. I mean, this is honestly, I can't stress how good this product is.
Yeah.
Yeah, it's just amazing. You're welcome. We won't be seeing that again. Luckily, we've got a cupboard full.
Triple booster.
Yeah. So the reason why it's called triple booster is because there's 3 types of skin boosters.
Yeah.
There's ones that are hyaluronic acid, the phyllo, things
so
like that.
Already mixed it.
Polynucleotides, which is obviously salmon sperm. That's that range. You've got polylactic acid, which is what the threads are made of, and that creates collagen. And then the third one is what's the third one? Oh, the Beyonce Glow.
Yeah.
So what they've done here is they've added the benefits of Profilo, which is the HA, with the vitamin C, glutathione, and tranexamic acid. I mean, little things that people don't realise about glutathione is that our body, when we were in the womb, just before we became, is it an embryo? What's the stage before an embryo? There's that stage when you don't really look like anything, before 28 weeks. You know, when you can have an abortion. That thing, I can't remember what it's called. Whatever it's called, that stage. If you know what it's called, then please text me in.
Plasma.
No, it's not called plasma. No, it's I can't think.
Oh,
Someone Google it.
Anatomy is no good.
Right, so it's the stage just before the baby becomes visible. I can't remember what it's called.
Beam.
With that thing then inside the baby's mommy's tummy is 70% glutathione.
Oh, really?
Yeah, if you Google it. So every single cell in our body uses glutathione. In the medical field now, they're starting to think that glutathione can help with cancer. So if you Google glutathione and cancer, then there's a link there now, which they're looking at, which is fabulous. But it was Beyonce's doctors that worked out if you add glutathione, thyroxinic acid, and vitamin C together, you get that reaction. And in fact, a patient of colour today came in, and what I did was I stuck some on her one hand, left it there for 5 minutes, and you can visually see it glowing. It's pretty amazing. So yeah, so that's in there.
Yeah, amazing.
And of course, you could also do other things with glutathione. You can use the creams.
Yeah.
Retinol, really anything.
Yeah.
It's all good. Right, we're done. So listen, get booked in. If you want to join the Cashback Club, then the first 20 don't pay the joining fee, which is fantastic. Olivia's waiting for your comments, and you're here tomorrow?
Yeah, I'm here tomorrow. So maybe we can do live.
Yeah, we'll do this live maybe, and then Bina can do it on you so we can talk about it.
I can do myself.
No, you can't. Right, we'll see you later.
Bye.
Bye.